we took the mindfultinnitusrelief.com course, and we offered it for free during the COVID pandemic for anybody all across the world, not just the United States, but it basically touches every corner of the world. And so gosh, at the time we got quite a number of people into our study, and the data set was about 577 people, a pretty large group. And so if I can jump to the conclusions here, what we found is that in just 3 weeks of taking this mindfultinnitusrelief.com course, we were seeing significant reduction based on the tinnitus functional index and the perceived stress scale, significant reduction in tinnitus bother.
Hey everybody, this is Michael Piscos from Mindear, and you're listening to the Tinnitus Unplugged podcast, the show that answers all your tinnitus questions and helps guide you through your tinnitus journey. Tune in regularly to listen to a variety of world-renowned tinnitus experts share valuable tinnitus management tips and information to help you manage your tinnitus. To learn more, visit us at www.mindear.com. Welcome, everybody, to another episode of Tinnitus Unplugged, a podcast by Mindear. I'm very excited to introduce our special guest today, Dr. Jennifer Gans. I've been fortunate to know Dr. Gans for many years, both as a friend and as a colleague. We've presented together at a number of conferences, and she is one of the leading experts when it comes to working with people who experience bothersome tinnitus. Without any further ado, I'm going to hand it off to Dr. Gans to tell her a little bit about herself and her experience working with the tinnitus population. Dr. Gans, please tell our audience a little bit about yourself.
Well, it's wonderful to be here today. Thank you for inviting me on. And this is a topic that is near and dear to me. And so any opportunity to share what I've learned over the years is a very enjoyable opportunity for me. So I appreciate you having me on.
We're glad to have you.
Yeah. So let's get right down to it. I am a clinical psychologist. And when we think of tinnitus, oftentimes we think of the ears and we think of, audiologists or ENTs as being involved. But over the last 14 years or so, I have kind of been a different perspective on the tinnitus puzzle. And so, again, I appreciate you having me on to be able to share my perspective that's based now on thousands of hours of working with people with bothersome tinnitus. So again, I've learned an awful lot from my patients, and what I hope to be able to do today is share what I've learned and my research through the years. And so as a clinical psychologist, I'm in private practice right now, but have worked in many, many areas of tinnitus really throughout my whole career. So while I was at UCSF at the Cochlear Implant Center as their clinical psychologist, I became very, very interested in tinnitus. Obviously, the patients that we were getting into UCSF there at the Cochlear Implant Center, they were struggling with severe hearing loss, but many of them were talking about a side symptom or a symptom of tinnitus, and they weren't able to get much satisfying help. And so, I guess it's partly my personality. I had to dig into it because it was unknown in many ways.
Right.
And so that's when I started doing some research. At the same time, I was learning about the incredible work of Jon Kabat-Zinn and his program called Mindfulness-Based Stress Reduction, and the amazing results that he was getting with this 8-week program with chronic pain. And at the time, anytime I had learned anything about chronic pain and its treatment, it made me wonder, I wonder if this would work for somebody with chronic tinnitus, because in many ways they're bedfellows. And so it was around that time that I tried to marry the two, or was curious about marrying the two. If we're having such great results with a mindfulness program for chronic pain, perhaps we would have similar results for chronic tinnitus.
Right.
And so I designed a course called Mindfulness-Based Tinnitus Stress Reduction. And it basically was a course that, similar to Jon Kabat-Zinn's work, but all the meditations, all of the lessons, all of the programming was specific to the person with bothersome tinnitus.
Right.
And so we'll probably be talking more about that program, which is
Yeah,
now, yeah.
that's great. I mean, so for our audience, Dr. Gans is one of the leading um, people out there when it comes to incorporating mindfulness to help people find some relief from their tinnitus. As you mentioned, mindfulness-based stress reduction. Can you tell our audience a little bit more about what mindfulness actually is? It seems like it's one of those hot terms thrown around today that you see a lot more of than you did, say, 10 years ago. But share with our audience what mindfulness actually means.
Right, right. So let me first start off by saying that as a clinician, I'm a big fan of anything that works.
Yeah,
Okay.
I completely agree
So,
with you.
so when a person is thinking about tinnitus, you cannot come at it from one perspective. Okay. So I am only talking about mindfulness as an approach to helping the person with bothersome tinnitus, because at the time, and certainly there are more now, but at the time, nobody else was.
Right.
And so
Truly one of the pioneers of bringing this to the tinnitus community.
well, thank you. But so there's many different, I talk with my patients about cobbling together a management plan that helps people shift tinnitus from bothersome to non-bothersome. Now, tinnitus is a benign body sensation. So, which is incredibly can be very life-changing
Sure.
well, just to throw numbers at it, about 20 million Americans, but it is benign. And so if I ask my patients, if you have a benign body sensation for the rest of your life and it doesn't bother you, can you live with that?
Uh-huh. It's a great
And
example. Yeah.
and often and hopefully every time the answer is, well, sure. I mean, if I have something that's benign and it doesn't bother me, then so what? Right.
Uh-huh.
And so when I'm talking about shifting tinnitus from bothersome to non-bothersome, that's what that is the bulk of my work, or that is the pinnacle of my work, is help. So again, sitting for thousands of hours with patients, I've learned a lot about the tinnitus personality, which I'm be happy to share with you today,
Uh-huh.
but also about the brain and how it works best. For all you musicians out there, or people that enjoy music, I think of the brain like well, let's just say a Stradivarius.
That might have been on my side.
No, wow, Michael, I'm sure it was on my side. Something is really going on. Should I, whoever's going to be editing is going to
Yeah,
edit
let's
that
let's
out?
just continue on. We were talking about the brain.
Okay.
Yeah.
All right. So, when I talk to people with bothersome tinnitus, I see their brain as a symphony.
Uh-huh.
Okay. And we'll tie this back to
Uh-huh.
mindfulness in a moment. So, for example, I have a young child and she was curious about the brain one day. So we walked over to the computer and we looked on the internet, and here we pop up this picture of the brain, but it was color coded. And I looked at it and I was like, wow, that looks a little bit like a symphony, or the chart, I guess you'd say, of a symphony, with, the occipital lobe in red,
Uh-huh.
the parietal lobe in blue, and all the different colors of the sections of the brain. And it reminded me of an orchestra. You have the violin
Yep.
section, you have the trumpets, you have the
These
clarinets, you
groups of
have,
instruments coming together.
right. And individually, it's not an orchestra, but when they
Correct.
play together, and they're all in tune, they
Yeah,
can make amazing music. And
absolutely.
so when I'm sitting with my tinnitus patients, because again, tinnitus is a benign body sensation, and let me reiterate, an incredibly life-changing one for people who are bothered by it. So
Oh,
benign doesn't mean unimportant.
right,
Benign just
right.
simply means it's not an indication of a greater illness. But anyway, going back to the symphony of the brain, so basically, I'm sitting with patients thinking, well, gosh, why is their brain out of tune? Because the brain is misunderstanding a benign body sensation. That essentially is what is the sticker, I
So
guess you
the
could say, for.
representation in the brain is being misunderstood somehow.
Well, yes, and it's the body sensation itself is being misunderstood and put into the danger category, when in
Uh-huh.
fact it can go into the uninteresting, or just not worth paying attention to
Yep,
category, and
unimportant.
pushed into
Sure.
the background, which is the definition of habituation.
Yep.
So, so when I'm working with my tinnitus patients, I'm wondering, well, why is their orchestra out of tune? And everybody knows, and we'll get to mindfulness in a moment. Everybody knows that when you go to a symphony, the conductor gets up and taps the lectern and stops for a moment, pays close attention, and makes sure that the violin section is playing in the key of A, the oboes are playing in the key of A, the clarinets are playing in the key of A, so that all of a sudden you can, when the music starts, you can make magic, just beautiful music. And so, I think of the human brain, whether you have tinnitus or not, as that symphony. And who do we think we are to, nobody would start a symphony without tuning the instruments. Who do we think we
Right.
are to leave the house in the morning without tuning our own instrument?
Uh-huh.
Okay. So let's talk about the simplicity of meditation and the simplicity of mindfulness. And so when I say that, I oftentimes I'll mention meditation or I'll mention mindfulness, and people will be like, oh, no, 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 I can't do that because my mind wanders.
Mm,
And I chuckle inside when I hear people say that because of course your mind wanders
right.
because everybody's mind
Of course.
wanders. It's designed to do that.
Right.
So it's not so much about the wandering mind. The question is are you aware of where your mind is? And that is a human capacity. So it is part of us, this
Right.
ability to bring awareness to whatever we're paying attention to.
Uh-huh.
So when I talk about meditation, sometimes I don't even use that word because it has been, I don't want to say, well, maybe you could say distorted through our culture in many
Sure.
ways. And
Sure.
so I like to call it an awareness building exercise.
Okay.
I'm asking the patient, where is your brain at any given moment? Because when we find out where our brain is at any given moment, we can notice that we're creating stories unbeknownst to us, creating these stories that are, and I'm using signing right here to
Uh-huh.
show how we have tinnitus, which is this benign body sensation, but it's getting wrapped up in a story. And this story is
A
not a good one,
narrative. Yeah.
right? This Gordian knot, this, you're wrapping it up in, oh my God, this is all my fault for all the music I listened to when I was a kid.
Sort of
Oh
these
my
these
God.
collection of negative thoughts.
Right, right. And so what we're dealing with here is this part is benign, but we're wrapping it up and it's ossifying.
Uh-huh.
What will I do? I'm not going to be able to concentrate. How am I going to do my job? Or, does this mean I'm going to lose my hearing? Or, oh my God, maybe I have a brain tumor. And so
Right.
what we see here is at a certain point, we're no longer talking about tinnitus. We're talking about the stories that are getting wrapped around it. And for those of you out there that know about mindfulness and meditation, or meditation and mindfulness, or this type of uh, tool of tuning our brain, you realize that you're bringing awareness to the stories, the necrotic, the erroneous stories that are getting wrapped around
Uh-huh.
this otherwise benign body
Is it
sensation.
fair to say that someone could be reinforcing them?
100%.
Yeah.
100%. And quite honestly, an interesting area that I've gotten into recently is basically the trauma
Mm.
of tinnitus. And if we know that when we experience a trauma, this memory can get stuck, almost
It's
like
a
foods can
yeah,
get stuck in your throat. It gets stuck in your
it's
brain
its
and it's
mark.
not able to emulsify and become, uh, I think of the brain and well, it's not able to come to fruition and
Right.
be digested, so to speak. And so people can get stuck.
Yeah.
And these neural pathways, once they're set, the brain likes to, you could say our brains like the repetition, or they can become lazy. We just, that becomes a slippery slope that we
Sure.
just kind of settle into
Sure.
unless we bring awareness to where our mind is.
Yeah.
And so my job is to help people, number one, feel less anxious about tinnitus. And that goes back to it being benign, less anxious about tinnitus, become an expert in what it is. Human beings,
So
the human
learn
mind,
about it.
right?
Right.
Uh, Absolutely. It's humans are meaning making creatures. When we become educated about something, we become less anxious.
Yeah.
Okay. When we don't know what something is, or we have false information about what something is, our fear levels go way up.
Yeah.
and our mind's eye stays kind of locked and
Yeah.
loaded on whatever, whatever it fears, kind
Sure.
of,
Sure.
like a camera lens getting zoomed in, and it can get stuck zoomed in when it should be able to very easily or kind of naturally
If you
zoom out
adjust.
when
Yeah.
necessary, exactly, adjust. So number one, helping people to feel less anxious about tinnitus. Number two, making sure they are an expert in what it is. No false information, just true facts. And the last thing is cobbling together a management plan that helps them shift tinnitus again from bothersome to non-bothersome.
Right.
Now, again, going back to the symphony of the mind, what meditation is doing is it's focused awareness on what is. And it is basically making sure that every area of the brain is not playing sharp.
Uh-huh.
Again, for another analogy that I like to use in my patients is a Stradivarius. For those who know violins, this is the most prized instrument out there as far as violins go. And so imagine you take this beautiful violin and you take the four pegs of the violin and you crank it up super, super tight. So boy, are the strings are
Yep.
super tight. And then you pick up this violin, this beautiful instrument, you start playing, and it doesn't sound very good, right? And so you don't throw out the violin. What do? You just
Tune it.
retune the violin. And
Uh-huh.
so, as a clinical psychologist, my job is to help people learn how to tune their orchestra, tune their violin. And the people that I do see with tinnitus they're all walking around sharp. For those who understand,
Uh-huh.
what can happen to the strings of a violin, they can become
Sure.
very sharp if they're tight. And so, the top three complaints of people with bothersome tinnitus are anxiety, depression, and sleep difficulty.
Yep.
So, we have tinnitus, which is benign, but what people tend to find that when we're doing our work together is that it's actually not about tinnitus. Tinnitus is benign, but it's what brings them into
Sure.
or it's what brings them into their healthcare provider. But it's never about tinnitus. It's about the fire that's below it, and the fire that's below it is anxiety, depression, and sleep difficulty. These are the top three.
Yeah.
And so you can go into the research with mindfulness meditation. These studies have been replicated over and over and over again that a mindfulness meditation program or practice are excellent for anxiety, depression, and sleep difficulty. And so I think that's why I've had so much success with the work that I've done, is because I think we are, again, with that camera lens, we're staying
Uh-huh.
hyper focused on tinnitus, when really, if we can open up that lens and start to see it within the
Yeah.
scheme of everything else going on,
There's a
we
lot
realize
that's
that the
affecting it.
fire,
Yeah.
the fire underneath it is anxiety, depression, and sleep difficulty.
Yeah.
So,
So there's a couple things that stood out to me there that I find quite interesting. One, when you mentioned you don't throw out the violin, you retune the violin. You know, to our viewers, what that tells me in kind of layman's terms is you have the mechanisms, right? You don't throw out the system. You just have to retune the mechanisms that are, as you mentioned earlier, within your capability. So I think that is a great example of sort of commitment and perseverance to the process, because you have it within you to get where you want to be, because you have the mechanisms necessary to achieve the goals you want. And then the other thing I thought was interesting, you had mentioned the word awareness a number of times. And you talked about becoming educated in tinnitus, becoming an expert in tinnitus. What I find interesting that's a little bit different than some other management techniques out there is you're suggesting, and I agree with you, that you kind of confront your tinnitus. Don't shy away from it. Don't try and mask it away. Although some things like sound therapy can be helpful, don't be afraid to confront it. So, like you said, educate yourself about it, read about it, right? And at the same time, understand that there's other things that are wrapped around the tinnitus, and don't be afraid to confront those things. So don't always just try and mask the tinnitus. It's okay to confront the tinnitus as well. Would you say that's fair?
well, yes, you said a couple of really important points here. What I hope to help my patients see is that actually nothing's broken in their brain. And I call it the tinnitus trifecta, if I can just take a moment to talk about it.
Sure.
is the tinnitus trifecta. It's funny how things with tinnitus seem to happen in threes. But there are three things that all of my patients have in common, or I should say anybody with bothersome tinnitus has in common. Now, this is based again on the thousands of hours that I've sat with patients.
Hmm.
Now, for the purpose of demographics for a moment, in just the United States alone, we have 50 million Americans who have tinnitus.
Hmm.
But we have to look at that 50 million and start to understand that 20 million are bothered enough by tinnitus to go to their doctor and say, oh my God, this is not okay.
Yeah.
I need help. So if we do the math, that leaves 30 million Americans that are walking the streets of our country with tinnitus, and they are not bothered by it.
Hmm.
Okay, so we have the 20 million bothersome group, we have the 30 million non-bothersome group. They're walking the streets of this country and they don't really care that they have tinnitus. They
Sure.
might have it, but they can very simply
Yeah.
push it into the background. And many of us probably know people like this.
I know myself. I get it from time to time and just distract myself with something else.
Right, right. And so the people that I'm seeing are not in the 30 million group. I'm not seeing people like you because tinnitus doesn't bother you enough to
Sure.
even present to your doctor with it.
Exactly.
Now we have 20 million Americans that are bothered enough by it to go to their doctor and say, oh my God, this is not okay. Now I have learned a lot about this 20 million group, and everybody in this group has three things in common. Okay. And I call it the tinnitus trifecta.
Hmm.
Number one, they all have hearing loss. Now that's interesting for some and not so interesting for others. Okay. With another opportunity, we can dive
Dive
deeper into
into
what do I
that.
mean by
Yeah.
that. That's a whole
Hmm.
nother conversation. But as humans, we all have hearing loss after a certain age. It's kind of the
Hmm.
nature of the accumulation of birthdays here that we all have.
Yeah.
But anyway, so they all have some form of hearing loss, whether measurable or not.
Hmm.
Number two, 100% of them have stress. Okay. And we definitely talk about that in my work with my patients. Number three, they all have an amazing personality. Okay. And I want to just do a bit of a party trick here, and I want to
Sure.
describe this amazing personality. And for anybody who's listening to this podcast, or uh, can see if it fits themselves, if they
Sure.
have bothersome tinnitus, or somebody that they know or somebody that they work with that has bothersome tinnitus. So when I say amazing personality, I actually really mean amazing personality. Now, the personality that I'm going to describe to you is one that has made them very successful in their work. It has made them who they are. It's what they love about themselves. It's what makes them show up on time for work and get things done and just succeed in their lives. So it's really the underbelly of this amazing personality that is pulling this patient down,
Hmm.
or this person down. And so this amazing personality, and just ask yourself if this fits, if you have
Sure.
bothersome tinnitus. So everybody that I see in my practice, they all are the kind of person that are very, how should I say, very alert in this world. They hear things, see things, experience things. They're very alert. And if they walk into a room, they scan the room, and if they spot a problem, they latch onto that problem and they
Mm.
have trouble letting it go until they figure it out.
Mm.
Okay. So I don't mean this by way of diagnosis per se, just more as
Sure.
a descriptor. They
Yeah.
can oftentimes be a little bit obsessive compulsive about the way they
Hmm.
go about certain
Certain
things. They're
personality type.
right. And so what I'm really describing is a person that has maybe an overactive amygdala, which is again another topic we can go into, but just a little extra helping, let's say, of
Sure.
anxiety.
Sure.
And so, again, I want to go back to that personality where if they spot a problem, they latch onto it and they don't let it go until they figure it out.
Right.
And so, what is great about that personality is, who doesn't want somebody in their life that spots a problem, latches on, and
Sure.
doesn't let
Yeah.
it go until they figure it out, right?
Solutionist.
Absolutely. And
Yeah.
so my work is not getting rid of the personality. It's about shaving off the edges so that they can live um,
More freely.
right, more freely.
Yeah.
Okay. And so, but something that you brought up before is this idea of something being broken. When I'm working with my patients, I want them to fully understand that, at least regarding tinnitus, nothing's broken. Their
Yeah.
brain is
Yeah.
perfectly wonderful the way
Yeah.
it is.
Yeah.
All I'm trying to tell them is that their strings are too tight.
Yeah.
They're
You're not
playing
broken
sharp.
as a person. We just need to, as you said, retune the instrument a little bit.
Retune the instrument and start to perceive tinnitus accurately.
Yeah.
And
And
if
then
your
and then that
brain,
sound will become more harmonious again, right? As you get in tune, you're now back to the baseline of what it should.
right, exactly. And going back to that camera lens, inside
Yeah.
our mind, we get locked and loaded on something fearful.
Yeah.
Okay. So when somebody experiences tinnitus for the first time, the brain is like, what's that?
Yeah.
And the lens gets locked and loaded. Now, the problem with my tinnitus patients is that their lens stays locked and loaded.
Yeah.
There's nothing broken,
They
it's
have no way to
stuck.
adjust it.
And
Yeah.
that goes back to the stories that get wrapped around
Yeah.
tinnitus, because that's essentially what's keeping the lens locked and loaded. And so my work is to help them retune their instrument, soften, unravel the stories so that their mind's eye can still see tinnitus, but it's within the context of everything else around it.
Sure.
So really, if anything is broken, and again, there's nothing I would say is broken, it's about getting stuck. So
Yeah.
every tinnitus patient I'm working with is stuck. And so as clinicians, we want to help people get unstuck. And I have found that, again, I want to say that there's many ways to get unstuck, but what a mindfulness meditation program or practice does for you is it helps create some space between you and whatever is in your mind's eye at the time. And with this space and freedom, we can now respond to tinnitus rather than react to tinnitus. And that is the major difference.
Yeah. Yeah. And one of the
So,
things I love about the mindfulness approach and is it's not only applicable to tinnitus. Today we're talking about applying it for tinnitus, but as you kind of mentioned earlier, in certain personality types, they may apply it to other situations in life. So
yeah.
for our listeners who may struggle with that stress, who might, you can, and tinnitus is part of something that they're struggling with. You can apply this to your tinnitus, but you can also apply it to other aspects of your life as well. It's one of the great things that I always loved about mindfulness is it can help in so many different capacities in life.
Yeah, I'll share with you something funny that recently happened. So perhaps we'll talk more about it, but I developed an online course called it's mindfulness based tinnitus stress reduction, but the online version of it is mindfultinnitusrelief.com. And
Wonderful.
so this research project that I did at UCSF, it had amazing results. So I flipped it into an online course so that people all over the world could take advantage of it. And so it's an online course, and I occasionally will get some emails from people taking the course. And there was this one woman who wrote to me and she said, Jennifer, it's funny. After just 3 weeks of taking your course, my tinnitus isn't bothering me as much anymore. And I'm getting along better with my husband. And so as a clinical
Yeah.
psychologist, I facilitate other people's better living, so to speak,
Their
their
wellness, their
happiness, their
well-being.
wellness.
Yeah.
Exactly.
Yeah.
And so when I get a message like that, it makes me smile because,
Yeah.
again, tinnitus is what brings them in the door. But there's that saying, pain in life is inevitable, but suffering is optional. And so what tinnitus is teaching us is that tinnitus comes into a person's life as pain, but it's how we suffer with that pain that makes or breaks how we live this life,
Mhm.
right? And so a mindfulness meditation program or practice, it becomes, a way to help them suffer less with any pain
Sure.
that comes into their life, be it tinnitus, be it another chronic pain, be it a work conflict, be it a relationship issue. And so what people find is that they, again, have more choice and freedom in their lives.
Yeah. And then that could generalize to other aspects of your life that could be also being affected by the tinnitus and the stress that's being caused by the tinnitus, as you mentioned, better relationship with your spouse, allows you to
Right,
live more
right.
freely, right?
Exactly. And
Yeah.
you mentioned before also before I forget is this idea of moving into tinnitus. Okay. So the reason why I encourage people to move into tinnitus is that when people come to me, they've already worked very hard to ignore tinnitus.
Yeah.
So it would be kind of insulting for me to tell one of my patients, oh, just try to ignore it. Try to ignore it. Why? Because they've been trying to ignore it since
Yeah.
they got it.
Right.
And if they're not successful with that, why
Yeah.
would I tell
They're
them to
looking
do
for a different
something?
approach.
Right. And so because tinnitus is benign, why not move into it?
Yeah.
Why not move into it? There's no danger in it.
Sure.
And so I'm not going to tell a person to do something that they've tried and hasn't worked for them. In fact, I'm teaching people to move into tinnitus and start to see it as a paper tiger, which is what in fact it is. Now, for those who don't know what a paper tiger is, it's actually very obvious. It's a tiger in and of itself is scary, but thank God it's made of paper, right? So I call that a paper tiger. Tinnitus is a paper tiger. For many, it feels very scary and very life-changing, but it is made of paper. And so by being able to move into tinnitus, by that, they can start to re-experience it in a more peaceful, more uh, less fearful way, so that the lens can just naturally get
Sure.
unglued and start to open up, and you start to re-perceive tinnitus accurately
Yeah.
for as a benign body sensation.
For our viewers, what's the average or the expected time? And granted, it's going to vary from person to person. What's kind of the expected time that a mindfulness program takes in order for people to start perceiving those benefits?
Well, that's a great question because we just did some research on that.
Wonderful.
So we just had a study published in March of 23, so just not too many months ago, that was looking at just that. We took the mindfultinnitusrelief.com course, and we offered it for free during the COVID pandemic for anybody all across the world, not just the United States, but it basically touches every corner of the world. And so gosh, at the time we got quite a number of people into our study, and the data set was about 577 people,
Huh?
a pretty large group. And so if I can jump to the conclusions here, what we found is that in just 3 weeks of taking this mindfultinnitusrelief.com course, we were seeing significant reduction based on the tinnitus functional index and the perceived stress scale, significant reduction in tinnitus bother. Now, the course itself is 8 weeks. And so we measured again at 8 weeks, and we found that there was even an increased significant drop in tinnitus bother
Excellent.
based on the TFI, tinnitus functional index, and perceived stress scale. Now, yes, we are seeing significant drop in 3 weeks, but in all honesty, if you get an even greater drop in 8 weeks, while I'd like to encourage people to take the course for just 3 weeks, I'm going to, of course, encourage them to go the full 8 weeks
Sure.
because they'll see a more lasting result. And then we assessed 6 months later to see long-term benefit, because sure, it's great if your tinnitus isn't
Gotta
bothering you in
stick though.
3 or 8 weeks, that's
Sure.
great. But I'm really curious to see the long term in the long
Sure.
run. And
Sure.
so 6 months after the study was completed, we retested people, and we found that patients were maintaining their gains, meaning their
Wonderful.
tinnitus was less bothersome, and it continued to be less bothersome
Yeah.
significantly. So, it's
Well, I think there's a couple of things that stand out to me there. One, 8 weeks is a small investment for a lifetime of living more freely, as we
mhm.
just talked about. Um, and two, that it seems like one of the reasons why the low scores may hold over time is, I imagine, and correct me if I'm wrong, is the skills they learn during these programs or on some of the other platforms that are available today as well are techniques that they can continue to use over time. It's not just something you have to use in the 3 weeks or the 8 weeks. It's something that you can continue to incorporate in your life as you move forward, which can continually help you through life.
Absolutely. And
Yeah.
so, this 8 week program, people wonder, well, why is it 8 weeks? Well, again, we're working with statistics here, but it takes on average about 8 weeks to learn a new habit. And so what we're trying to do with people that are taking this 8 week course is we're trying to teach them new habits, not and so on average it takes about 8 weeks. And so developing, for example, you pick up a tennis racket, it takes about 8 weeks to be able to really kind of just you
The
take
brain
eight
has to
weeks
make those adjustments to learn.
Exactly,
Sure.
exactly. And so once somebody's done with the 8 week course, it's actually just the beginning of the rest of their lives. So you have really kind of just stepped up to the plate and gotten the basis in a mindfulness meditation program and started to create the neural networks that help you with the repetition and the kind of the ease at the start of your program. But really, the eighth week is the beginning of the rest of your life, as you just
Yeah.
mentioned.
Yeah.
And again, people, again, I'm a psychologist, and people are like, well, why are you working with tinnitus? And I say, you know what? Because it's not about tinnitus. It's about developing
Skill
ways of
set.
approaching the
Yeah.
right skills that can increase wellness. And,
Absolutely. Absolutely.
that's what I do as a clinical
Yeah.
psychologist.
Yeah, it's wonderful. And I think it's important to mention to our viewers that, if you're someone who's been trying different platforms, different tinnitus management programs, and you don't experience the benefit that we're talking about here in 3 to 8 weeks, that's not meant for you to be discouraged.
Yeah.
Because for some people, it just takes a little bit longer to tune that instrument. So, our message to those individuals is to stick with it, and don't be afraid to try new things, as Dr. Gans mentioned earlier. Be open, as long as it's not something that's hurting you, or decreasing your health or your well-being, be open to something. Because I want to make sure that people that don't find that benefit that quickly understand that you can still get the benefit. It just might take a little bit longer.
And again, there's, the tinnitus healing. Remember, I talked about the tinnitus trifecta. Now I'm going to talk about the tinnitus healing triad. Again, what I found in my work is that three things are necessary in order to help people with their tinnitus healing. Okay. We spoke before about becoming an expert in what tinnitus is.
Mhm.
Oh, no, the first one was actually feeling less anxious about tinnitus,
Yep.
becoming an expert in what it is, but then creating a management plan that helps you shift tinnitus from bothersome to non-bothersome. And I have gone full heart into mindfulness meditation. Why? Because it's non-pharmacological, and there are side effects of it, but the side effects are wonderful.
Right.
So there's no
Yeah.
harm in it. What I love about mindfulness meditation is you can be using it or practicing it at 3 p.m. in the afternoon. You can also practice it at 3 a.m. in the middle of the night. So it's something that goes with you everywhere. You don't need a
Anytime,
prescription for
anywhere.
it.
Yep.
Right, anytime, anywhere. And it also, what it does is it puts tinnitus into the lap of the person with tinnitus. And that is anytime that there's something going on with me, I want to take responsibility for it, because then I can feel the sense of efficacy, like I can change this. And I think in our medical field in general, we sometimes give over our own responsibility for healing. And what a mindfulness meditation practice helps us do is says, you know what? This is something that I have to learn how to manage for myself. And so, it's certainly important to get guidance on
Mhm.
tools and how to do that. But the people that I think are really able to solidly shift tinnitus from bothersome to non-bothersome are the ones who can really take full responsibility for
Sure.
what's happening in their own body,
Yeah.
and then realizing that nothing is broken and that they are just needing to make small shifts or retune their instruments so that they can live with more joy.
As people can, reduce their stress and their tinnitus becomes less bothersome, is there any evidence, is there any research that shows the benefits of mindfulness on cardiovascular health?
Well, yes. I mean, this is something that we could all Google very easily. We know that elite athletes, I mean, elite athletes, Olympic medalists, they're using mindfulness meditation again, not to make them faster, better, what have you, but simply to get their minds tuned in order to be able to be the best they can be at whatever they've chosen to do.
Yeah. Yeah.
So, honestly, I mean, we could get off from this call and start Googling around and see that mindfulness meditation is just good, a good practice.
Yeah.
Who wouldn't function better in this world if all the parts of their brain are working in coordination rather than
Yeah.
working against other parts of the brain?
Yeah.
Because then we start to be able to perceive our our world and perceive our world internally and externally with equanimity and balance.
Yeah.
And that's just
Yeah.
better
I think
living.
balance is a key word there, right? Um, as we wrap up here in the final minutes, I'd love to get your thoughts and kind of your vision as we've talked about mindfulness for the last little bit here. What's your hope for the future of mindfulness as it pertains to tinnitus and more generally as well?
Well, mindfulness has always been here, and mindfulness is here to stay. It's human capacity. We're all capable of being present in the moment without judgment. Now, for the field of tinnitus, my hope for the future is for us to step away from this kind of doggedness when it comes to finding a cure in the form of a pill or procedure, and start to educate. Remember the tinnitus healing triad, helping people to feel less anxious, helping ourselves to feel less anxious by making sure our brain is functioning in balance. Number two, making sure we're an expert in what tinnitus is, not fear. We have a lot of fear mongering and people getting caught up in these chat rooms, and it becomes a bit, for lack of a better way to put it, kind of a cesspool um,
Negative
of
thought or
yes,
yeah.
and every person is individual. So when we fall into somebody else's story, we're just wrapping up our tinnitus in yet another story. So
Mhm.
unfortunately, there's predatory providers, or we have a lot of
Some gimmicky,
misinformation out there,
yeah, some
gimmicks, snake oil salesmen, what have
mhm,
you.
quick
So we have
fixes.
to, right, we have to be
Be
very
wary of
careful out
those.
there.
Yeah.
Right, right. And so again, becoming an expert in what it is. And so again, that's part of my joy in my profession, is to teach providers how to talk to their tinnitus patients. And I hope that in years to come, more providers, whether and moving away from ears, ENTs, moving away from ENTs, and even audiology, and more into just general providers,
Mhm.
your general, your GP, your other therapists, and such like that, helping them to understand tinnitus so that we can be speaking accurately about what tinnitus is to our patients and start to understand the anxiety that's fueling it.
Mhm.
Uh, and number three is helping ourselves with tinnitus by cobbling together management plan. Anything that reduces stress is going to be helpful for tinnitus. Now, obviously, meditation is wonderful for stress reduction, but
Exercise.
so is exercise. So is sound. Ears love to
Mhm.
hear. So when you give your ears something to hear, whether it's uh, enjoyable music or rainfall or white noise, purple noise, pink noise, whatever it is, ears love to hear. So by giving our ears something to hear, it helps us to our brain to kind of relax and be able to put tinnitus into the background where it belongs, so to speak.
Yeah.
So anyway, I can talk about all the different types of things that are helpful, but as far as where the future goes, I would like people to take responsibility for their own tinnitus and start to point their finger at the real source of tinnitus, which is anxiety, depression, and sleep difficulty.
Yeah. So continue to bring awareness to that triad as you had mentioned. And one last time for our viewers, I believe if you do want to explore the mindfulness program from Dr. Jennifer Gans, it is mindfultinnitusrelief.com. Is that correct?
That's correct. That's a
Okay.
quite a mouthful, but that's correct.
So mindfultinnitusrelief.com for our viewers if you'd like to check out that program and see if that's something that might fit you well. You can also check out the Mind Ear app that also has a lot of complementary tools to what Dr. Gans has talked about as well. And to finish up for our viewers, I think one of the key things we talked about today is that there's not a one size fits all solution for everybody. Mindfulness is one of number of different solutions we talk about in these podcasts. Working with you over the years, I have seen the benefits and the power of mindfulness when practiced appropriately. So I highly urge all of our viewers today, if it's not something you've tried in the past, to be open to it, and potentially explore that and see if that's something that works for you. With that said, I want to thank our guest, Dr. Jennifer Gans, today for taking the
Thank
time to
you.
speak to us. We look forward to having you back on a future podcast, and we can dive into more. And I'm sure we could talk for hours about
Uh,
different aspects of tinnitus. So thank you again, and we look forward to having you back on.
yes, and thank you so much, Michael. I look forward to it.